And good afternoon. Welcome to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, downsizing, and the senior living industry.
And I'm Corrie Sirota, clinical social worker and psychotherapist specializing in grief and loss.
Coming right up on the first half of today's show, Healthy Brains, Healthy Lives. We're going to be talking about maximizing your brain health at any age with neurologist Dr. Lesley Fellows. She's just fantastic. You're going to want to hear that's coming right up. Corrie, just before that, I want to talk about a big presentation actually this Wednesday that my wife Stephanie and I, we're going to be presenting to FADOC. FADOC is Canada's largest seniors organization with over 500,000 members. We're really looking forward to this. It's going to be a presentation on downsizing and senior living trends. That's this Wednesday at 6:30 p.m. And if you haven't heard of FADOC, that's FADOQ, it is an amazing organization, 55 plus, and they have tons of discounts, tons of services, free webinars, and so we're looking forward to presenting this coming Wednesday. And what do we got coming up on the second half, Corrie?
On the second half, seeing that that October is Pregnancy and Infant Loss Awareness Month, we're going to have someone who's created a baby loss program to help people cope with this reality. That's coming up after the 3:30 news.
Yeah, looking forward to that. Very interesting. All right. Has the pandemic taken a toll on your mental health? Maybe we call it a little brain fog. Well, you're not alone. And how can we improve our brain health? So we decided to reach out to Dr. Lesley Fellows. Dr. Fellows is a cognitive neurologist, professor, Department of Neurology and Neurosurgery, and the Vice Dean, Academic Affairs, Faculty of Medicine and Health Sciences at McGill University. It's a lot, Corrie. And her research and clinical work is based at the Montreal Neurological Institute. I've had the chance to talk to Dr. Fellows before, and she is just amazing. Dr. Fellows, welcome to Life Unrehearsed.
Thanks for having me.
Well, thanks for joining us. Such an important topic these days about all this brain fog and how we can try to maximize our brain health. You know, the pandemic has been difficult for many people, and it's taken a real toll on our brain function. Why is that, Dr. Fellows?
Well, I think we often maybe take our brains for granted. The brain is a really complicated biological machine. And as such, it's easily thrown off by any number of factors, poor sleep, worry, disrupted routines, information overload. And when you think about it, the pandemic has thrown all of those things at us and more. So it's really no wonder that people are noticing brain health challenges. It's sort of showing us, I guess, the vulnerabilities of our brains. We're asking a lot of our brains.
I'm so glad that you're mentioning this because it validates what I see in my practice. It's what I hear from my friends and colleagues. This is something that has definitely taken a toll on so many in so many ways. So I think it's really important that people hear this. Now let's talk about how both this has affected individuals and societies. I'm going to start with individuals. How important is it to effectively manage our stress?
Well, I think the good news about the brain is it is vulnerable to factors like stress, but these are temporary effects. These are not usually permanently harming the brain. So if we can adjust things, for example, address stress, make changes to take the load off the brain will bounce back. It's complicated, but it's also a resilient organ. So we have the power, I guess, to help ourselves feel better from that point of view.
And it makes sense about, with the pandemic, and it has been more stressful for a lot of people. We're talking with Dr. Fellows here on Life Unrehearsed with Matt and Corrie, and we're talking about maximizing our brain health and getting some suggestions and why we are a little bit more in this brain fog, as we call it. So stress was one thing. How about sleep, Dr. Fellows?
Your brain really needs sleep, and it's usually the first thing to go when things get complicated. So sleep is important to the brain's function, and the same factors that are disrupting sleep are probably also disrupting brain function during the day. So people are often not sleeping well because they're worrying. Those worries are going on day and night, so it sort of adds to the trouble. Maybe they're not getting their usual exercise, they're not sleeping well. Exercise is good for the brain. So it tends to be kind of a vicious cycle where all these factors are simultaneously putting pressure on the brain. So any change in any of them, whether it's better sleep, more exercise, stress reduction will help the brain work better.
I hear you. I often tell clients that they're their own worst enemy and that they're their best therapist at night. And so they spend time ruminating about all kinds of issues. So we need to be learning how to manage that. What about social engagement? How does brain function affect, or the brain fog affect the social engagement?
That's a really interesting question. Often when people think about complex brain functions, they think about working on maybe hard problems, tough assignments at school or at work. But some of the hardest things we ask our brains to do are social things. They're having conversations like this. They're interacting with people we don't know very well, covering new topics, trying to guess how a stranger's going to behave when we interact with them for the first time. This actually calls on a lot of brain power. So in that sense, it's a very engaging thing for the brain to do. It's generally rewarding. The brain's really made for social interaction. And I think the experience of isolation in the pandemic has really shown us how much we miss that interaction when we can't have it, or we can't have it in a face-to-face sort of way that the brain is designed to have interaction. So I'm a big fan of thinking about social interaction as excellent exercise for the brain. It's really one of the most important things the brain is made for.
Talking with Dr. Fellows here about maximizing brain health. And, you bring up, I think, such an important point. I see that a lot in my world in interacting with seniors and senior communities, and that's one of the major reasons why people are moving into retirement homes is due to social engagement. And another factor, you mentioned rewarding, and you've talked about doing things that matter to you. And I think that is such an important point, and you talk about rewarding. Tell us a little bit more about why we should be doing things that matter to you.
Well, one of the things that's really interesting about the brain is that the biological systems that are involved when we learn to do new things are really driven by reward. And I mean that in a really general way, so positive feedback. That boosts the new connections that the brain is making. So if you're interested in having your brain challenged and thinking about trying to take advantage of brain plasticity, the best sorts of things to do are things you really enjoy, because when you get them right, or when you make progress, or when you learn to do them better, you're engaging reward systems that are really powerfully boosting your learning. And so if you love to do something, or really want to learn something, or really enjoy interacting with a person, those are all good ways to really engage your brain and make the most of it.
So I think that this is an important piece, because people would typically, when it comes to new things, what's maybe one of our defaults is fear, right? And I always say that fear is fantasized experience appearing real. So I'm hearing you say we need to challenge ourselves, we need to challenge our brains. Can you talk more about how the brain responds when we do that?
Well, if we stick with things we know how to do really, really well, the brain's not learning. It's carrying out functions, and that's fine. That's useful. But if you're interested in improving your sort of brain plasticity, or maintaining, then you probably want to do things that you're actually not good at, or that you're not perfect at. And the learning signal for the brain is when what happens isn't quite what it expected. And so when you're perfect at something, every time you do it, it turns out the same. But when you're learning and making mistakes, that's what drives brain plasticity. So it's fine to embrace mistakes. Perfection is the enemy of brain plasticity. I think people should continue to challenge themselves throughout their lives, because it's an important way to keep the brain working.
I love that. Perfection is the enemy of brain plasticity. We talk about Sudoku and all these brain games and so on. And if you keep doing the easy one, well, challenge yourself, move up a level, or try something completely different.
Welcome back. You're listening to Life Unrehearsed. I'm Corrie Sirota, along with my co-host, Matt Delvecchio, and we're both feeling good as we talk to neurologist Dr. Lesley Fellows about how we can maximize our brain health. And boy, oh boy, do we ever need it more now than ever with the COVID-19 pandemic, living this life, we call it brain fog. So let's get really down and dirty very quick. What's the one thing we can do right now that's going to help give us a direct impact on our brain health?
I would say it's to quit smoking.
Get out.
Yeah.
You serious?
I thought I might surprise you with that.
Yeah.
I think people don't realize how important the health of the body is for the health of the brain. They sort of think of the brain as being off by itself. It's a hugely energy-demanding organ. It takes up 20% of our blood flow. That blood has to flow up there through blood vessels, and the health of the blood vessels in the brain is crucial to brain health. And smoking is if you smoke, the first thing to do to improve your brain health is to quit smoking and get your cardiovascular system working better.
Amazing. Who would have thought? And for all the non-smokers are cheering, and all the smokers are saying, "Oh, come on! Did
Matt,
you really have to give that answer?"
You know what? No wonder we're so smart, Matt.
Speak for yourself. All right. Just before traffic, Dr. Fellows, we were talking about what we can do as individuals to maximize our brain health, but it's far more than just us as individuals. And I'd like to address society in general, Dr. Fellows. What can society do to have a direct impact on maximizing our brain health?
I think there's maybe two answers to that question. The first is maybe the obvious one, that brain health begins in utero. It's early life experience, the importance of having good health all the way through life. Excellent education. These are all things that society offers families and children. But I think those ideas about offering appropriate support, education, all the way through life, maybe we need to think about more. What are we doing to make sure that people are continuing to get the most of their brains, to make the most contribution they can make through the entire lifespan?
So I'm going to ask you sort of on the other side of that. When you, I guess, what are your recommendations if you have family members who see one of their loved ones is exhibiting, I guess, or a little off in terms of maybe memory, etc.?
Right. So I think it's important to keep separate two ideas. One, that brain function varies a lot from day to day in all of us. And we were talking already about the many factors that could lead to people being a little off, a little forgetful, distracted, overwhelmed maybe. That's something to do. We need to do something about. We talked about how we could try to address that, and that's in a way normal, especially under conditions of a lot of stress. Mm-hmm. But there are also, of course, illnesses that can affect the brain, and they're common. They range from Alzheimer's disease and conditions like that, to stroke, to mental health conditions that are also affecting the brain. So any of those could show up as suboptimal brain function or a change in how people are behaving or thinking. And if it's more substantial, especially if it's affecting people's day-to-day functions and they are no longer able to do things they could do before, then that definitely deserves to be looked at more carefully. And there are many, many causes. So often requires a trip to the doctor to try to see what's going on.
I won't hold you to it, but are there certain signs and symptoms that would make, or what we should be looking for to go, this seems a little off?
I think the main thing is that we all have forgetful moments or can't come up with the right word on the spot. So people shouldn't panic if they have those experiences. Those are temporary. It's when it's persistent, a change from before, and it's affecting people's function. That's when I'm more concerned from a medical point of view.
We're talking with neurologist Dr. Lesley Fellows here on Life Unrehearsed, and you're bringing up an important point too. We can't necessarily panic. We have what we call our senior moments and we forget something, but when it does start affecting function and there's repetition and maybe forgetting people's names, or you're driving somewhere and all of a sudden you get lost, these are little trigger events that may have you pose a question, because the next thing to that is, how do you address that? And these are very sensitive topics because most people are in some form of denial, but you do need to keep a look at it. And you know what? If it means getting to the doctor, it's better to be safe than sorry. We're slowly running out of time, Dr. Fellows, but we know you're doing a ton of work at the Neuro and lots of research, and we're very, very grateful that you're coming on the show to share some of your experiences and research. And one project that's dear to your heart that I know you want to address is something called chronic HIV Positive Brain Health Now, which is a public-facing website. Can you quickly tell us about this?
Well, that's one of the areas where we've been doing a lot of research. People growing older with HIV, thanks to the antiviral medications that are now available, are experiencing brain health challenges, and we've been trying to understand why. So that's a project where we've really been able to look holistically at all the different factors that may play into brain health, including mental health and cognitive thinking health. That's a project we've been running for several years, and it's been really informative, really showed us the many factors that play in and the many ways that we can help people feel better from that point of view. So people can check out the details on the website.
I was just curious, can you share some of your findings with us?
Well, what we found is that it's not a simple problem, which is a good thing, because it means there are many things that we could potentially help those patients with that increased forgetfulness or more challenge with focus as they get older isn't necessarily a sign of an untreatable degenerative brain disorder. It could be due from everything from medication side effects to substance use to social factors like isolation and stigmatization. So it really shows us that there are many ways to get in and help people maintain quality of life and maintain their function and their work despite having serious chronic illness.
It's such good work you're doing, and congratulations on that. We're just about to wrap up. We have to hit you with one more question. I get this all the time with my clients and seniors looking to transition. They ask me about, these brain games, Sudoku, I'm told to do those. Tell me about these brain games, Dr. Fellows. Should we be encouraged to do them? Is it a myth? What are your thoughts?
Well, it's true that if you practice something over and over again, you'll get better at it. So if it's a game that you want to get better at, then you should do lots of it. You'll get better. But that doesn't necessarily generalize to you using your brain in other ways. So I'm going to come back to what I said at the beginning, that the most important thing for keeping your brain in tip-top shape at any age is to keep it engaged, to do things that really are important to you, that are meaningful and that are challenging. Social interactions are a great example of that. And I don't want to stop people from doing Sudoku, but I don't specifically recommend it. Get out there and interact with other people and do things that matter.
What sound and sage advice. Thank you so much, Dr. Fellows. That's Dr. Lesley Fellows, a prominent Montreal cognitive neurologist, professor, Department of Neurology and Neurosurgery, and the Vice Dean, Academic Affairs, Faculty of Medicine and Health Sciences at McGill University. AKA very busy person.
Thank you so much
for...
Thanks for having me.